My name is Elizabeth Ngasa. I'm presently at Bradman University pursuing my DMP program. Today I'm going to present Shareholder Educational Plan. The Shareholder Educational Plan, the need for intervention. This I'm going to talk about diabetic. Diabetic is a chronic metabolic disease that results as insulin insufficiency. There are two types of diabetes. You have the diabetic type 1 and diabetic type 2. In this project, I'm going to focus on diabetic type 2. Approximately 90% of the patients diagnosed have been diagnosed with diabetic type 2. The prevalence of the diabetic continues to increase. As a result, cost-effective and efficient strategies need to be implemented. That is why we have this need for intervention. This is because the economic burden that it has on the patients diagnosed with diabetes. For instance, the American Association of Diabetes stated that the cost of diagnosing diabetes in 2012 was $245 billion, while in 2017 the cost rose to $327 billion. Which indicate an increase of 26% increase in total costs. The stakeholders group in this project is diabetic self-management, improve adherence to treatment, migrate disease-related distress, and improve health outcome. Translating this evidence into real-world practice is required. Diverse group of people ensure effective implementation of the design intervention because of diverse skills and knowledge. All the stakeholders will be educated on the negative impacts of insufficient management of diabetes, including the economic impacts. Evidence of the effectiveness of physical activity as a factor that improves patient outcome will also be presented. Stakeholders will be informed about the progress of each step via video communication like Zoom meeting, and each will be reminded of their role frequently. The role of the stakeholders. Although more than 40 interventions have been designed to improve care for patients with the diabetes, therefore there are discrepancy in diabetic care and outcome. Okay, in regards to this, there are three main group of stakeholders for this project, including which has family members, colleagues, friends, who provide material, social, and psychosocial support for patients to continue working and adhere to their interventions, such as taking their medication. Walking is a physical exercise. This also is we also need like a physical health coach that trains specific exercise to these patients that will be reassuring to the patient. The individual will also guide, the health coach will also guide the patient on the best way to optimize clinical outcome. For example, incorporating aerobic exercise. The healthcare provider, on the other hand, will diagnose, educate patient, and also deliver intervention designed to improve patient outcome. The nurses educate patients of the causes of diabetic, the treatment option, the need for lifestyle modification, how to take their medication, and the impacts of failure to adhere to treatment. This will all be done by the healthcare provider. So we've talked about the various roles and what they do. We talk about the family, the patient's friends. We talk about the healthcare coach fitness and what he does with exercise. We also talk about the healthcare provider. So now we move to the theoretical foundation. The theoretical framework is a foundational viewpoint which guides a researcher in the complex analysis of a proposed topic of interest. With this, a theoretical foundation or framework usually originates from its various disciplines, which serve to produce a new dimension surrounding a specific topic. To effectively translate theoretical theory into practice, a theoretical basic must be used to improve the understanding of a specific clinical problem. Guidance to this scholarly project utilizes the health belief model. The walking in itself is a patient's effort. Thus, it is self-management. Several factors influence a patient's ability to implement this intervention. The health belief model intervention interferes that a person's perception of a trait of an illness and their perception in the effectiveness of a given intervention predicts their likelihood to modify their behavior. The conceptual framework. The health belief model assesses that for an individual to take preventive action, in this case, a 45-minute walking 3 times a week, the person should believe in their susceptibility to a disease, complication, and that implementing a specific intervention will lower their risk of developing the illness or complication, in this case of developing complication. Besides, the model has several constructs such as perceived, self-efficacy, and barriers to implementing a specific intervention. Therefore, our study variables include patients' perception of diabetic and diabetic-related complication, perceived self-efficacy, and barriers, while the dependent variable is clinical outcomes denoted by hemoglobin A1C. Educational needs for stakeholders. Family members now and loved ones play a very, very crucial role in the consistency of intervention implementation. Much of care provided to this diabetic patient actually takes place in a home setting. Family members are really crucial in this. They are the support that the patient needs. They cope with their illness. Family, the positive attitude, the effectiveness of communication, therefore, should be supported. Educating the family members also about diabetes, its consequences, importance of the patient support, and also politely reminding the patients on their need to physical exercise, on their need to adhere to their medication regimen, that they take their medication on time, and also their eating habit should be incorporated. Expert healthcare providers will provide education about diabetes, about the diagnosis, communicate results, and give information about diabetes and its long-term impact. The plan for delivering intervention. Healthcare providers, family, and healthcare fitness coach will help in project implementation, anticipating barriers to project implementation, including resistance to change by patient and care providers. However, adequate stakeholders' education on this impact of physical exercise or the reduction of A1C level and the economic impact also economic impact of the diabetes is complication will likelihood ensure less resistance. The approval of the project by the nurse manager is crucial because it is where the studies will take place in the clinic. Every stakeholder will be updated regarding the policy and plan and timelines of the project, mainly via a visual communication. The project is projected to take place within 3 months, and during this 3 months time, prior to the project, they will check the A1 level, hemoglobin A1 level, and at the end of the project also that will be checked. Okay, so the period of evaluation using this project is stipulated objective will be done. This patient perception on physical exercise barrier and intervention, implementation frequency of exercise level among will be also reassessed after completion of the project. So they will be checked A1C at the beginning and at the end. So this at the end, this comes to the end of my presentation about the shareholder education plan on regards on diabetic type 2 patient. Thank you.